Trish is the first nursing executive for ECU Health. Good morning. How are you?
Good morning.
Good to see you. Good to see you. I feel like we've met before.
We have. I was on your show a little bit, maybe less than a year ago, talking about last year's Great 100 recipients.
Oh, that's exactly right. And now you've got a new title. And this is the first time that ECU Health has named a chief nursing executive, correct?
Yeah, so been here a little bit over a year and a half now as ECU Health's first chief nursing executive with responsibility for nursing across the region. So all 9 hospitals, 150 clinics, and really our strategy for what it means to be an ECU Health nurse and how we become really the national model for nursing excellence in the rural healthcare space.
We have so many great things we can hang our hat on here with this medical facility and the ECU School of Medicine, but our ECU School of Nursing, one of the tops in the country for many, many, many years. I'm very proud of it because my wife and daughter are graduates, and so ECU nurses are very much a part of my life. But tell us about your first year here at ECU Health.
Yeah, it's been a really busy first year. It went by really quickly, working with great teams of nursing leaders and our nursing team across the entire region, really trying to identify what the needs are, stabilizing our team, and making some decisions about where we go from here and the great work ahead of us. So excited to be able to share some of that with you today.
And I've talked recently on the show about when my mom passed away a little bit over a year ago, and other hospital stays that my family members have had, the incredible care that they've gotten and the excellence in nursing. It's a culture that's been created, I think, here in Greenville and throughout the ECU health system. Talk about that, the innovation. I know the labor market is difficult these days. We seem to not be able to ever have enough nurses, but there is an amazing culture of excellence with our nursing program here.
Absolutely. And that's honestly the most important thing that we do as leaders in terms of cultivating that culture and making sure that we are listening to and building relationship with our teams. And for me, that means representing and advocating for the largest part of our healthcare team, which is our nursing team. So when you think about just back as recently as 2022, we had 25% turnover in our nursing team.
Wow.
25% turnover. When you think about that loss to our healthcare system, as well as honestly, we can't recruit enough to compensate for that on any given year and be able to provide the level of care that we need to. And it speaks to really needing to understand why people are leaving us, why people are leaving healthcare, and what do we need to do with our nursing teams to create an environment where they feel empowered, where they feel supported, where they feel like they have an active voice in their environment, and creating a culture of excellence and something that they want to be a part of. We've done a tremendous amount of work in that space over the last year and a half, and I'm happy to share with you today that our turnover is 13%.
Oh, wow, down from 25.
Down from 25%, and we're better than the nation. We're leading the nation
that's great.
in
That's
terms
great.
of our turnover compared to others.
I guess the COVID
volumes.
pandemic took a toll, right?
The pandemic took a toll, but I think also, when you think about our nursing team, to be focused on the future, to be focused on excellence, they want to feel that they have a sense of ownership, that they're not just showing up and working a shift, that they're a part of creating something great, that they're a part of something bigger. It's not just coming in and taking care of that patient for that one shift, that they're a part of something bigger. And you have to be able to bring them in the design of their work environment, in the design of where we're going, and really being a part of creating something just bigger than ourselves. And I think that's where we've really felt momentum over the last year and a half. We held a big nursing summit. We had over 500 of our nurses through our nursing summit over the course of 2 days, really focused on the future, providing education for them, and being able to anchor with our united purpose in terms of advocating for nursing and where we go from here.
Talking to Trish Baise, ECU's first chief nursing executive. I just read that ECU Health Medical Center has earned magnet recognition again. I think that's the third consecutive time, right? Can you talk about that? What does that mean? What is magnet recognition in the healthcare field, and how does it impact the patients?
So magnet designation is a really rigorous program in order to be accredited. It's through the American Nurses Credentialing Center. There are less than 10% of the hospitals in the country who are designated as magnet organizations, only 11 in North Carolina.
Wow.
You have to go through a rigorous program where you submit all sorts of documentation, including your quality outcomes, all of the things that you do related to nursing. And then they come on site and have several days of on-site survey, meeting with our teams across the facility. And you're only designated if you can meet some pretty rigorous criteria in terms of all of the expectations and standards, your quality outcomes, as well as when they do the survey, they want to reconcile that the things that you put in your document are actually going on, and they need to feel it and see it when they're within the walls of the facility. And we got a resounding, we see it, we feel it. You have a culture that is excited, that is engaged, that is truly empowered to drive excellence, and your outcomes and the direction you're headed is showing that.
So essentially, it means you're at the top of your game.
Absolutely, and that's our nursing team and what they do every single day.
Yeah, how's it impact the culture, the nursing culture?
I think it attracts people to want to be there. First and foremost, it creates a team that recognizes that they can do things that are bigger than what they had anticipated, that they recognize that one thing they do during the course of their shift is bigger than that one step, that there are significant outcomes attached to that. So when we look at infection rates that have dropped 23 and 34% over last year, and then additionally more improvement this year, they recognize the impact that they have globally on our region.
My friend Ashlyn, who helps me prepare for these interviews from the communications office at ECU Health, has mentioned to me the APEX concept, which advancing nursing practice and excellence. Can you talk about that and what that means to the patients?
Absolutely. So when I began here, we knew that we needed to be able to put together a nursing strategic plan, and where do we need to be a year from now, 3 years from now, 5 years from now, put together a great group of nurses and nursing leaders from across the region to work through that. What we recognized pretty quickly is we needed to really understand our nursing team in a very comprehensive and meaningful way to design that work. So we embarked on a massive research project, and we spent months shadowing our nurses. I was one of the investigators myself. There were 40 of us. We spent hours with our nurses understanding what their day was like, what their hopes, their dreams were, what they wanted to see in terms of ECU Health Nursing. And we're using that research to inform that. And when you have that kind of a team, and when you have the design built on really engaging nursing excellence, the impact to the region is certainly excellent nursing care, collegial practice with our physicians and our other teams to be able to drive quality outcomes and great experiences for our patients across the region. But the special thing about rural healthcare is the attachment to the community. The things that we heard from our nurses is that they want to be involved in a broader way with their community. So you'll see so many of our nursing teams are involved in volunteerism outside, and they want those opportunities, and they want to see the impacts that they're having on the community beyond just the transactional piece within healthcare. They really want to see improvement in health outcomes and an elevation of the community even beyond healthcare.
How about the nurse residency program at ECU Health? Tell us what that is.
Yeah, so our nursing residency program is also nationally accredited and was recently reaccredited for the third time. So it is
Congratulations.
Yeah, absolutely. Very excited about that. It was a big week. That all happened on the same day a couple weeks ago. That program is really that year-long transition. So our nurses have graduated. They are now licensed nurses, and they are transitioning into practice as independent nurses. So that is not just our orientation program, but really all the wraparounds that we provide with them that include mentorship, include support from our educators, simulation exercises, additional pieces, and actually a part of that also includes volunteering within one of the organizations in the community. So oftentimes they're involved in programs that are providing food for those with food insecurity and other things like that, so they get to know their community as well. it really provides an opportunity for them to feel much more confident and ready when they're functioning independently as a nurse. And we found that that also translates into our rates of turnover, and that individuals feel better prepared when they're less scared and feel like they have those supports and they've built the relationships that they stay with us.
You know, I continue to say this. I'm always amazed. I know we've got one of the largest hospitals in the country here with the ECU Medical Center. People may not realize that we are, I think, have more admissions than any hospital in the state. And am I right about this? I believe Brian Floyd said we were 11th in the country or something like that. So, you know, there's a lot of opportunity to do a lot of great things and a lot of opportunity for things to go wrong. And, you know, people are in the hospital and they get, you know, it's usually one of the worst times of their life. But I'll tell you, every experience I've had with the ECU nurses, ECU health nurses, and I mean not just one or two, but all of them have just been unbelievable, just incredible people, incredibly compassionate. They really seem to care about our family and just went over and above. I was trying to send something to their homes and they wouldn't let me. I was bringing them donuts, and they were like, "We don't need any more donuts." But I was bringing. But then when my mom passed away, and I wanted to do something, there were 2 or 3 of them. I wanted to send something to their house, send them to dinner, or something. They wouldn't let me do that. I mean, they're like, "No, this is what we do." So the collaboration, I mean, we're so fortunate here because of ECU Health, but also the university, Pitt Community College.
Absolutely.
You work hand in hand with all of those, and that creates a pretty nice opportunity for us, doesn't it?
Absolutely. Those academic practice partnerships are critical, especially in our setting when you're in a rural community. The ability for us to be able to grow our own is paramount, not only because the individuals who are here tend to want to be here and practice here, but it also provides us an opportunity as we work through additional programming with our educational institutions across the region to bring people into healthcare who might not have otherwise even had opportunities to attend college. And we have great programs that allow us to be able to help somebody come into entry-level positions and then continue to grow throughout the course of their career with us.
So you mentioned your strategic plan. You've been there for a year now. What's next? Where do you go from here with your vision?
Gosh, there's so much ahead of us, really. A lot of it has been bringing all of our nursing team together under a common vision. So a lot of the work we're doing is around, yes, absolutely those academic practice partnerships, continuing to make sure that our team has a voice, because really it's our nursing team that's going to tell us where we go from here. So it's continuing to invest in our nurses in terms of their development and in terms of ensuring that they have what they need to be successful, not only in their careers, but as members of our community. Really, really great things continue to be ahead for us. I think you'll see more of our facilities continue to attain accreditation similar to the medical center, and this entire health system will be recognized for nursing excellence nationally.
Trish Baise, ECU Health's Chief Nursing Executive. You're awesome.
Oh, thank you. I represent an awesome team, so they make me look good.
No, you know, every time I say this over and over again. We're just so fortunate to have such a world-class health facility and medical facility here in Greenville, but it's all about the people internally. And, you know, it seems like everybody I meet, I just come away so impressed with what you do. You guys have a big job. You have a big, big job. And so, you know, it's amazing to me what you do accomplish there. And we appreciate it. Thank you for that.
Thank you. I appreciate it.
Good to see you.
Good to see you.
Appreciate you being here this morning, Trish.